Get back to your desk, Sullivan. You're a liability. Touch a nurse, Dr. Bennett Caldwell said it loud enough for the entire hallway to hear. He didn't lower his voice. He didn't even look at her when he said it. He just pointed like he was directing traffic toward the reception desk, while every pair of eyes in that corridor landed on Sophia Sullivan and the way her left leg dragged slightly behind her right. Nobody defended her. Nobody said a word. They just looked away. And that silence was its own kind of cruelty. If you are new here, welcome. Please subscribe to our channel, hit the notification bell so you never miss a story, and drop a comment telling me what city you are watching from. I want to see just how far this story travels. Now let us get into it. Sophia Sullivan arrived at Mercy General the same way she arrived everywhere, early, quiet, and completely underestimated. She clocked in at 6:43 in the morning, 17 minutes before her shift officially began. The night nurse at the desk, a young woman named Priya, handed over the chart updates without making eye contact, which was fine. Sophia was used to that. She set her bag down behind the counter, pulled her dark hair back into a tight bun, and began reading. She had been working at Mercy General for 11 months. 11 months of filing charts, answering phones, triaging low-priority patients, and being very carefully kept away from anything that might require her to move too fast. Because Sophia Sullivan limped. She had limped since the crash in Kandahar 3 years ago, when the medevac helicopter she was riding in took a hard impact on landing, and her left leg was crushed between a collapsed panel and the frame of the aircraft. She had survived. 3 members of her crew had not. When she came back stateside, the military had given her a medical discharge and a citation she kept folded in the back of her wallet. The hospital had given her a desk and a look that said, "We are doing you a favor." She knew what they thought of her. She heard it in the careful way people spoke around her, the way shifts were arranged so she was never alone in a trauma bay, the way Dr. Caldwell's jaw tightened every time she walked into a room he was already standing in. Like her presence was an inconvenience. Like her limp was contagious. What none of them knew, what she had never told any of them, was that before the crash, before the discharge, before Mercy General, and its fluorescent lights, and its careful silences, Sophia Sullivan had been Angel 6. She had been the flight nurse that Marine units requested by name. She had worked on conscious patients in the back of moving helicopters in wind and noise and chaos with nothing but her hands and her kit, and the kind of focus that most people never develop even in a lifetime of trying. She had saved 41 lives in active combat zones. She had been awarded the Navy and Marine Corps Commendation Medal and cited for valor in 3 separate field reports. She had stitched a man's femoral artery shut with improvised sutures during a 40-minute flight while the pilot was taking evasive maneuvers. But she limped. So at Mercy General, she answered phones. The morning of the 14th started like any other. Sophia was updating intake logs when she heard the first alert tone, a low repeating pulse that meant the emergency system was activating. She straightened. Behind her, she heard footsteps picking up pace in the hallway. Then the second tone came longer this time, followed by a voice over the intercom that said, "Trauma team to Bay 1, code black activation. All available personnel to staging. Code black, mass casualty event." Sophia was already on her feet, chart in hand, moving toward the trauma corridor before the intercom finished speaking. She had done this before. Her body remembered it the way a body remembers how to swim. The muscles move before the brain finishes thinking. She pushed through the double doors and walked into organized chaos. Nurses were pulling supply carts. A resident was barking orders at an orderly. 2 attending physicians were pulling on gloves and talking fast about ventilator availability. And then there was Dr. Bennett Caldwell, standing in the center of the room like he always did, like the room was a stage and he was the only performer worth watching. He was tall, mid-50s, silver-haired, the kind of man who had spent so long being right that he had forgotten how to consider the possibility that he might be wrong. He had a voice that carried, and he used it constantly. He saw Sophia the moment she walked in. His expression shifted. Not surprise, something closer to irritation. The way you look at a baby that has gotten into a room it was not supposed to enter. "Sullivan," he said it flatly. "What are you doing in here?" "Code black," she said. "I'm reporting to staging." "I didn't call you." The intercom called everyone. He took a step toward her. Around them, the room was still moving, people rushing past, voices overlapping. But in the 5 feet between Sophia and Dr. Caldwell, everything went still. "You're not cleared for trauma bay rotation," that he said. "You know that. I have trauma experience. You have a permanent mobility restriction noted in your employment file, he said, which means you are a fall risk in a high-motion environment, which means you stay out of this room when we are running hot. He paused. Go back to your desk, Sullivan. Answer phones. That is what you're here for. She felt the heat move up the back of her neck. Not embarrassment, she was past embarrassment with him. It was something older and colder than that. It was the particular anger of a person who knows exactly what they are capable of and has to stand still while someone smaller tells them they are not enough. She opened her mouth. Dr. Caldwell. One of the other nurses, a woman named Terry, touched his arm lightly. The convoy information just came through. We've got at least 9 incoming. NATO personnel. Multiple blast injuries. Caldwell turned away from Sophia like she had already stopped existing. 9 casualties, possible more. Blast trauma, orthopedic, likely TBI cases. Let's move. He clapped his hands once sharp, a sound that scattered people into motion. Then without turning back, he said, Sullivan, desk now. She stood there for 3 full seconds. 3 seconds of every person in that room either looking at her or very deliberately not looking at her. She counted them. 1, 2, 3. Then she turned and walked back through the double doors. She did not slam them. She let them close behind her with their usual soft exhale of pneumatic resistance, and she walked back down the hallway to the reception desk, and she sat down and she picked up the phone and she began doing exactly what he told her to do. But her hands were shaking, not from fear, not from humiliation. From the effort of holding herself back. She had been holding herself back for 11 months. It was getting harder. The morning moved. Calls came in. She logged them, transferred them, flagged the ones that needed flagging. She could hear sounds filtering through the walls, the elevated activity, the cartwheels, the occasional sharp exchange of voices. She tracked it the way she had always tracked field situations, not consciously, but constantly, her mind building a picture from fragments of sound and timing. The first ambulances arrived at 7:20. She could hear the bay doors open. She counted the radio calls, 4 casualties initially, then 2 more, then a report of a 7th still en route. By 8 o'clock, the trauma bay was past capacity. She knew that without anyone telling her. She knew it because the pace of the calls changed, because she heard someone running, actually running down the hallway outside, because a nurse named Darnell pushed through the lobby doors looking for a supply cart, and when she caught his eyes for half a second, she saw the specific look she had seen on people's faces in war zones. Not panic, something past panic, the look of someone doing the math and not liking the answer. Darnell. She kept her voice low. How bad? He was already moving again. 7 in the bay, 2 more coming. Caldwell's calling for anyone with OR clearance. I have OR clearance. He didn't stop walking. Tell him that. She looked at the phone. She looked at the hallway. Then she stood up. She walked back to the double doors. She pushed them open. The trauma bay was louder than before, denser with people in motion. She spotted Caldwell at the far end, bent over a patient talking rapidly to a resident who was struggling to keep up. She crossed the room. People moved around her. No one stopped her. Dr. Caldwell. He didn't look up. I'm busy. You're short-staffed. I have OR clearance and trauma experience. I can take a secondary station. I said I'm busy, Sullivan. He still didn't look at her. His hands were moving efficient and practiced, and he spoke like she was a minor disturbance. A fly near his ear. There are 9 patients, and I have 9 people working them. Now he looked up. His eyes were cold in the way that powerful men make their eyes cold when they want you to understand the distance between you. You are not one of those 9 people. You will never be one of those 9 people in my trauma bay. Do you understand me? Around them, the room had not stopped moving, but several people were listening. She could feel it. You're making a mistake, she said. I make decisions, he said. Not mistakes. Go back to your desk. Last time I'll say it. She held his gaze for one moment, one long, measured moment. Then she turned and walked away. She made it back to the desk. She sat down. She put her hands flat on the surface to stop the shaking. Outside, through the lobby windows, the morning was gray and getting grayer. A weather front had been moving in since dawn, and the sky above the hospital had gone the color of old pewter. Snow was coming. The forecast had said 6 to 8 inches. She had checked it before she left home that morning, the same way she checked everything methodically because information mattered, because knowing what was coming gave you a few extra seconds, and a few extra seconds could be the difference between everything. She was staring at the window, not seeing it when the sound started. At first it was distant, a low vibration more felt than heard, the kind of thing you might dismiss as a truck on the highway or machinery in the building somewhere below. But it grew. Not gradually, it grew with sudden purposeful intensity, the way combat sounds grew, the way things got loud in war zones right before they got worse. She was on her feet before she knew she was standing. Through the lobby windows, she could see the parking lot. She could see people outside stopping and looking up. She could see watching the bare trees at the lot's edge and the flat gray December sky. And then she could see the helicopters. 4 of them. Military configuration. Flying in tight formation, dropping altitude fast, moving toward the hospital, with the kind of directional certainty that meant they were not lost and they were not looking for a place to hover. They were landing here. They were landing now. The lobby shook. The windows buzzed in their frames. Somewhere in the back of the building, she heard something fall off a shelf. The receptionist at the next station grabbed the edge of her desk and looked at Sophia with wide eyes. "What is stay here?" Sophia said. She was already moving toward the lobby doors. Outside, the cold hit her like a physical thing. The wind from the rotors was tremendous, flattening her scrubs against her body, throwing her hair sideways. She raised one hand to shield her eyes and looked up. The helicopters were landing in the far section of the lot. The reserve section, the one marked for staff, only the one that would fit 4 military helicopters if you parked them precisely, which these pilots were doing with the kind of skill that only comes from years of landing in places that weren't meant to be landed in. The rotors began to slow. The doors opened. Marines, 8 of them at least, moving fast, moving with the specific efficiency of people who do not stop to consider whether they should be somewhere. They move, and the question answers itself. They were in full cold weather gear, and they were armed, and they moved across the parking lot toward the hospital entrance like they owned every foot of ground between them. Behind Sophia, the lobby doors burst open. She turned. Dr. Caldwell was there and 3 other staff members, all of them looking past her at the lot with expressions that ranged from confusion to alarm. "What the hell is this?" Caldwell said. She didn't answer. The lead Marine reached the entrance. He was built like a door frame, dark-skinned, jaw-set eyes that scanned everything and registered it all in fast professional sequence. He looked at the people gathered at the entrance. He looked at Sophia. He stopped. Something moved in his expression. Something that was not recognition. It was more than that. It was relief. He addressed the group, but looked only at her. "We're looking for a nurse. Sophia Sullivan." His voice was clipped, controlled. "Goes by Angel 6. Behind her, she heard Caldwell make a sound that was not quite a word. She felt something happen in her chest. Something that had been compressed for 11 months, for 3 years, really, since Kandahar began to expand, slow and enormous, like a door opening in a wall you had forgotten had a door. She stepped forward. "I'm Sullivan," she said. The Marine looked at her, looked at the limp she was making no effort to hide, looked at the desk visible behind her through the glass, and then he said with complete steadiness, "Ma'am, we need Angel 6. Right now, we have a colonel down and 20 minutes of viable window left. You're the only one cleared for his protocol. Our orders are to bring you out." She heard Caldwell take a step forward behind her. "Now just a minute." The Marine did not look at Caldwell. He did not acknowledge that Caldwell had spoken. His eyes stayed on Sophia, and in them she saw the specific clarity of someone who has been in enough emergencies to know who the right person in the room is. "We have authorization from the base commander and full interagency clearance," the Marine said. "We are not asking for permission." He held out his hand, not offering help, not offering support, offering purpose. Sophia Sullivan looked at that hand. She looked back once at the hospital she had spent 11 months being invisible in. At the desk she had been sent back to twice today. At the face of Bennett Caldwell, who for the first time since she had known him, had absolutely nothing to say. Then she took the Marine's hand, not because she needed help walking, but because she was done doing this alone. She stepped forward into the cold, and the rotors were already spinning back up. And somewhere above the cloud cover, the sky was the color of everything that comes before a storm breaks open. And Sophia Sullivan walked across that parking lot without hesitation, without slowing, without looking back. Angel 6 was going back to work. The cold hit different when you were walking towards something that mattered. Sophia's left leg ached the way it always ached in low temperatures, a deep structural complaint, the kind of pain that had no dramatic quality to it, just a constant reminder that the body remembered everything even when the mind tried to move past it. She didn't slow down. She never slowed down for pain anymore. Pain was just information. Information she had learned to file away and deal with later. The Marine who had come for her, she didn't have his name, yet matched her pace exactly. Not slowing to accommodate her. Not surging ahead to show her she should hurry. He walked beside her like an equal, which was more than most people at Mercy General had done in 11 months. Behind her, she could hear Caldwell. His voice cut through the rotor noise, sharp and indignant, the voice of a man who was unaccustomed to being ignored. Sullivan, you cannot just walk off the premises during an active code black. You are a hospital employee, you are on the clock, and this is... The Marine beside her didn't break stride. He didn't look back. He said quietly, directly to Sophia and no one else, "We have priority clearance. He can call whoever he wants. It won't help him." "I know," she said. She didn't look back either. They reached the helicopters. The rotors had spun back to full speed, which meant the pilots were ready, which meant the clock was already running. The second Marine waiting at the open side door of the lead helicopter extended a hand to help her board. She took it not because she couldn't get in herself, but because in the field you accepted help when it was offered, and you didn't waste 3 seconds proving a point. She pulled herself into the helicopter and the door slid shut behind her, and the world outside Mercy General Caldwell's voice, the gray parking lot, disappeared. Inside, the noise was enormous. The familiar noise, the specific combination of engine and rotor and wind, that she had lived inside for 4 years of her life, the noise that most people found overwhelming and that she had always found clarifying. Like everything unnecessary got stripped away and you were left with only what was real. There was a man in the seat across from her. He was in his late 40s, lean face weathered in the way that came from years of outdoor service, not from age alone. He was in uniform, but his jacket was open, and he was leaning forward with his elbows on his knees, looking at her with an expression she recognized before she recognized his face. Relief. Complicated, urgent, barely controlled relief. Then the face clicked into place. "Hatcher," she said. "Major Jackson." Hatcher nodded once. "Sullivan." She hadn't seen him in 3 years. He looked older. He looked tired in a way that went deeper than sleep deprivation. He also looked at her the same way he had always looked at her, like she was the person he wanted in the room when things went wrong, which was the highest compliment Jackson Hatcher knew how to give. "You want to tell me what's happening," she said. He got straight to it. That was one of the things she had always respected about him. No preamble, no softening. "Colonel Richard Mayers, you know him." She did. Briefly. He was with the 2nd Marine Regiment when I was attached to the medevac unit in 2021. Older, serious, ran a tight operation. Still does. Was running one this morning. Hatcher's jaw tightened. "Convoy assessment. Supposed to be low risk. A road that's been clear for 8 months. Somebody missed something." He paused. IED vehicle went over. 3 casualties. Mayers took the worst of it: blast concussion, left leg compound fracture, internal bleeding that they couldn't fully assess in the field. They stabilized him enough to move and got him to the forward base, but the base surgeon has a situation he cannot handle and cannot explain. "What kind of situation?" Hatcher met her eyes. "Mayers is conscious. He knows where he is. He knows who's with him. He's talking. But something is wrong with his presentation and nobody can figure out what. His pressure's holding, his airway is clear. His neuro responses are within range, but every time they try to move to the next stage of treatment, he destabilizes. Not catastrophically. Just enough." He shook his head. "The base surgeon is good. He's been doing this for 12 years. He said he's never seen a presentation like this one, and he won't make another move without someone who's worked Mayers specifically." "I haven't treated Mayers specifically." "No, but you worked his unit for 14 months, and you know his file, and more importantly." Hatcher reached into his jacket and pulled out a folded document. He held it out to her. "He requested you, by name." She took the document, unfolded it. It was an official request form, the kind that required 3 levels of command authorization. It had all 3. At the bottom in the patient notes field, written in a handwriting that was careful and deliberate, even accounting for the fact that the person writing it had presumably been in significant pain, were 3 words, Angel 6 only. She stared at those 3 words for a long moment. He knows you don't work field anymore, Hatcher said. It was not a question. He doesn't know why, she said. Does it matter? She folded the paper and put it in her pocket. No. The helicopter banked. She felt a shift in her stomach, the familiar tilt of a fast turn maneuver, the kind pilots made when time was tight and altitude was their friend. Outside the small, reinforced windows, the sky had gone fully gray, heavy with the weather she had been tracking all morning. The snow was coming. How long to the base, she asked. 40 minutes. Hatcher looked at her steadily. He's been stable for about 90 minutes. The base surgeon is not comfortable with the window. He thinks there's something he's missing, and he thinks if he waits too much longer, the window closes. What's Maris's blood type? O negative? They've got supply. Allergies, penicillin family, it's in the file. I know it's in the file. I'm asking to make sure you know it. Hatcher almost smiled. Almost. Penicillin family, nothing else flagged. Any prior cardiac history? Negative. Respiratory? Clean. She was already running the case in her mind the way she had always run cases, not building a diagnosis because she wasn't a physician, but building a picture. The kind of picture that came from knowing how bodies responded to specific kinds of trauma, from knowing the patterns that fell between the clean categories on a diagnostic chart, from knowing that sometimes the thing that was wrong was the thing nobody thought to look for because it didn't fit the expected profile. Blast concussion, compound fracture, internal bleeding partially assessed, repeated destabilization during treatment, conscious, oriented, stable between attempts, unstable during. Something clicked. Has anyone checked his medication history for the last 6 months? She said. Hatcher frowned. Standard history was pulled. That's not what I asked. Has anyone looked at his full medication history, personal prescriptions? Not just what he declared to the base surgeon. A pause. Why? Because if he's been on certain blood pressure medications, the older generation, the ones some of the longer-serving officers get prescribed when they won't slow down long enough to actually address their cardiovascular stress, they interact with standard trauma stabilization protocols in ways that are not common knowledge. It wouldn't show on standard assessment, but it would cause exactly what you're describing. She looked at Hatcher. Stable until you push. Unstable when you do, like hitting a reset button. Hatcher stared at her. Then he pulled out a radio. She listened to him talk to the base surgeon, watched the surgeon's response come back in clipped, fast bursts that she couldn't fully decode through the radio static, but Hatcher's expression told her enough. His eyes went wide, then narrow. Then he lowered the radio and looked at her. He's been on clonidine for 8 months, Hatcher said. Off-label prescription, got it from a private physician's stateside, didn't declare it. Because he knew they'd ground him if he did, she said. Because he knew they'd ground him. Hatcher exhaled. The base surgeon says that explains everything. It's a complete contraindication with the epinephrine protocol they would have used for trauma stabilization, she said. Every time they pushed epi, they were triggering a rebound hypertensive response that then crashed. He would have looked like he was destabilizing from the trauma when he was actually destabilizing from the treatment. Hatcher relayed this back. The radio crackled. The surgeon's voice came through with a tone she recognized even through the interference, the tone of someone who has been holding their breath for 2 hours and has just been told they can breathe. He says he can adjust the protocol, Hatcher said. He wants to know if you'll walk him through it from the air. Put him on, Hatcher handed her the radio. For the next 20 minutes, Sophia Sullivan sat in the back of a Marine helicopter in a December snowstorm and walked a base surgeon through a modified treatment approach for a specific drug interaction that most emergency physicians had never encountered in a live trauma case. She did it calmly and completely and without notes because she had spent the last 3 years doing something everyone at Mercy General had overlooked. She had kept studying. She had kept reading every case file, every field report, every medical journal she could access because she couldn't be in the field, but she could keep being the person who belonged there. The surgeon asked precise questions. She gave precise answers. Hatcher sat across from her and did not say a word, but she was aware of his eyes on her, and she was aware of something in those eyes that she had missed without knowing she had missed it. The particular look of someone who trusted you completely. When she handed the radio back, the base surgeon's last words were, "I've got it. Thank you, Angel 6. Angel 6, she hadn't heard that name spoken by someone who meant it in 3 years. It moved through her differently than she expected. Not like triumph, more like coming home to a house you dreamed about so many times. The real thing felt simultaneously familiar and impossible. Hatcher took the radio, looked at her. "You haven't lost a step." "I've lost about 30% of my lateral mobility in my left leg," she said. "That's not what I meant." "I know what you meant." She looked at the floor of the helicopter for a moment, then up. "What happens when we land?" "Mayor's asked for you specifically. The surgeon has adjusted the protocol based on what you just told him. When we get there, you'll be able to assess directly, and they'll have a full surgical team ready if it goes that direction." He paused. "How are you, Sullivan, honestly?" She considered the question the way she always considered honest questions, carefully without rushing, without deflecting. "I'm functional," she said. "That's a very small word for someone like you." "It's accurate." "Is it enough?" She didn't answer that. Not because she didn't have an answer, but because the helicopter chose that moment to shudder a sharp sudden drop of about 15 feet, followed by immediate recovery, the kind of air pocket that in civilian life would have caused screaming, and in military aviation caused everyone to grab a handhold without breaking conversation. The pilot's voice came through the overhead speaker. "Major Hatcher, we've got a weather situation. Storm's moving faster than projected. I can get us to base, but I'm changing approach. We're going lower and faster. It'll be rough." "Do it," Hatcher said immediately. He looked at Sophia. She had not reacted to the drop, had not grabbed anything except the radio she had been holding. "Rough doesn't scare me," she said. "Nothing scares you," Hatcher said. It wasn't a compliment. It was an observation, the kind that contained equal parts admiration and concern. "Plenty scares me," she said. "I'm just better at choosing which things to let it stop me." The helicopter dropped again, this time a deliberate altitude reduction, the pilot pushing them lower to get under the worst of the storm layer. The ride got harder. The noise got louder. The whole frame vibrated with the particular violence of a military aircraft in weather. Sophia braced her feet against the floor, found her balance, and stayed completely still. She was thinking about Morris, about a colonel who had written Angel 6 only on a form while he was in pain and had meant every word. About a base surgeon who had been doing everything right and had been defeated by a fact that lived in a file nobody thought to check. About the specific gap between what people knew and what they thought they knew, and how often that gap was the thing that killed. She was also thinking with a clarity that surprised her about Mercy General, about the desk she had sat at for 11 months, about the double doors she had been turned away from twice in one morning, about Caldwell's face in that last moment before she walked away, the first time she had ever seen it genuinely emptied of certainty. She hadn't walked away from that hospital in defeat. She had walked away from it as herself for the first time in 3 years. And that felt complicated, more complicated than she had expected, because it meant that the version of herself she had been performing at Mercy General, the quiet, compliant, marginalized version, had required enormous effort to maintain. And the effort of maintaining it had been costing her something she hadn't fully named until this moment, in the back of a shaking helicopter, with the snow coming down and Hatcher sitting across from her and Mares waiting somewhere ahead. It had been costing her the belief that she was still herself. "Hatcher," she said. "Yeah. After this, whatever happens, I need to make some changes." He looked at her for a long moment. The helicopter shook. The storm outside was getting worse. Somewhere below them, a military base was adjusting a treatment protocol because she had answered a question. "Yeah," Hatcher said. "I figured." She nodded once. Through the window, the sky was the color of everything that comes just before something breaks. And Sophia Sullivan was ready, more ready than she had been in 3 years for whatever was coming next. The base appeared out of the gray, and the pilot brought them down hard and fast and exactly on target, and the doors opened, and the cold and the noise and the reality of it rushed in, and Sophia Sullivan stood up and did not hesitate and did not wait and walked out into all of it, because hesitation was a luxury, and she had never been able to afford it. The base was controlled chaos dressed up as order. Sophia had been on enough forward operating bases to know the difference between a place that was running and a place that was holding together by discipline alone. This one was the second kind. She could feel it the moment her boots hit the ground, the specific tension of people who had been managing a crisis for hours and were now managing their own fatigue on top of it. A young corpsman met them at the landing pad. He couldn't have been more than 24. He was professional, tight-jawed, moving fast, but his eyes gave him away. He had the look of someone who had spent the morning being afraid and was now pretending he hadn't. "Major Hatcher, ma'am." He addressed them both in one breath, already turning to lead. "Dr. Okafor is with the colonel. Vitals are holding since we adjusted the protocol. He's asking for you." "Which one of us?" Hatcher said. "Both," the corpsman said, but he asked for her first. They moved inside. Sophia matched pace with Hatcher, her left leg, doing what it always did in cold weather, complaining without stopping her. The base surgeon, Dr. Okafor, met them at the door to the treatment room. He was compact, mid-40s, with the calm eyes of someone who had trained himself out of visible panic. He shook her hand before she could introduce herself. "Angel 6, he said, "your call on the clonidine interaction saved his life. I want you to know that before we go in, I had him on a standard epi protocol, and I would have pushed it again within the hour." He said it plainly, without drama, which made it land harder than if he'd made a speech. "What you told me was something I should have known. It's not standard curriculum," she said. "It should be." He held the door. "He's alert. He's in pain, but he's managing it. I want you to talk to him before we move to the next stage. He's been asking for you since we landed him." She walked in. Colonel Richard Myers was 61 years old, and he looked it today in a way he probably never allowed himself to look on any regular day. He was in the treatment bed, left leg immobilized, and elevated an IV line in his right arm, monitors tracking everything about him with quiet electronic patience. His face was bruised along the left side, impact bruising, the kind that came from being thrown rather than struck. His eyes were open. When she came through the door, those eyes moved to her immediately, and something in them changed, not dramatically. Mares was not a dramatic man, but the change was real and she felt it. "Sullivan," he said. His voice was rough but steady. "Colonel." She moved to the bedside. "How are you feeling?" "Like I drove over an IED." He almost smiled. It looked like it hurt. "I understand you figured out what was killing me before any of the physicians on this base could. Dr. Okafor would have gotten there." "Maybe, but I had about 40 minutes of window left, according to him, so maybe is doing a lot of work in that sentence." He looked at her directly. No pretense. "I heard you weren't in the field anymore." "I'm not. Because of the leg. Because of a lot of things." He studied her for a moment. His breathing was controlled, the deliberate, trained breathing of someone managing pain consciously. "I asked for you because I remember what you did in Helmand, November 2021. You remember." She remembered. A Marine with a penetrating chest wound and a compromised airway who had been written off by 2 other medical personnel as unsurvivable. She had spent 38 minutes in the back of a moving vehicle doing things that technically required a surgeon, and she had done them anyway because the alternative was watching someone die when she wasn't certain he had to. "He's at Camp Lejeune now," Mayer said. "Sergeant first class, married, 2 kids. She didn't say anything. Her throat was tighter than she wanted it to be. "I'm not telling you that to make you feel good," Mayers continued. "I'm telling you because I want you to understand why I wrote your name on that form. I didn't write it because I thought you were available. I wrote it because I knew that if you were in this room, my odds were better than with anyone else. And I've been around long enough to know that kind of certainty is rare." She pulled a chair to the bedside and sat down, level with him, not standing over him, not stepping back, beside him. "Tell me what happened, in your own words, from before the convoy." He told her. She listened the way she had always listened, completely tracking every detail, her mind building the picture, not just of the physical event, but of the sequence. How his leg had taken the primary impact. How the initial pain had been severe, and then had, in his words, leveled off faster than he expected. How he had felt a sensation he described as pressure behind his sternum that the base surgeon had cleared as anxiety response. How he had been certain it wasn't anxiety because he had been anxious before, and it didn't feel like this. She stopped him there. The pressure behind the sternum, she said. When did it start relative to the first treatment they gave you on site? He thought about it. After, maybe 15 minutes after they started the IV. She looked at Okafor, who was standing at the foot of the bed. Any cardiac monitoring from that window? Basic, field equipment. Can I see it? He pulled it up on the tablet he was carrying and handed it to her. She read it for 60 seconds. Then she read it again. There's a pattern here, she said. Every time his pressure dropped and recovered, look at the interval. It's too regular to be trauma response alone. His heart is compensating for something that isn't resolved. She handed the tablet to Okafor. Has anyone checked for a pneumothorax on the right side, not left-right? Okafor looked at the tablet, then at her. His left side was symptomatic on presentation. That was our focus. I know, but the pattern here suggests bilateral involvement. Small right-side pneumothorax wouldn't have been obvious on initial exam if the left was louder, and a small bilateral would explain the compensation pattern. She kept her voice even informational, not confrontational. She was not here to make Okafor look bad. She was here to find what was wrong. It's worth checking before the next stage. Mayers was watching this exchange with the specific attention of a man who understood that people were discussing whether he was about to get worse. Okafor was already moving. He called for imaging support, and 2 corpsmen appeared with equipment, and the room shifted from conversation to procedure with the seamless efficiency of a trained team that had just been given a direction they could believe in. Sophia stepped back to give them room. She stood beside Hatcher, who had positioned himself near the door. You saw it in 60 seconds, he said quietly. I saw it because I wasn't focused on what they'd already found, she said. Fresh eyes. Don't minimize it. I'm not minimizing it. I'm explaining it. There's a difference. He almost said something. Then the corpsman closest to the imaging unit said, Doctor. And Okafor crossed the room in 2 strides and looked at what the equipment was showing and said quietly and precisely one word. There. Right side, small pneumothorax, exactly where she had said. The room moved fast after that. Okafor issued instructions without hesitation. He was, as she had assessed, an excellent physician, and once he had the right information, he used it without wasted motion. Sophia stayed in the room answering questions, when asked, staying out of the way when not watching the process with the focused attention she brought to everything in a medical context. Mares caught her eye during one of the brief pauses. He raised his eyebrows slightly, a question. She gave him one small nod. You're going to be okay. He exhaled, long and slow and controlled, and then for just a moment, the colonel let himself be something smaller than a colonel. She saw it, the weight of it leaving his face, the particular release of a man who had been carrying the knowledge that something was wrong and had not been able to name it and could now let someone else carry the naming. She understood that feeling. She lived in that feeling, just from the other direction. 35 minutes later, Mayers was stabilized in a way that was real and not temporary. Okafor came to find her in the small waiting area where she and Hatcher had settled. He sat down across from her without the tight urgency of earlier. He looked like himself, now still tired, but no longer afraid. He's going to need surgery for the leg, Okafor said. We'll transfer him when weather permits. But he's not going to lose the leg, and he's not going to lose anything else. He looked at her. I've been a field surgeon for 12 years. I've never had a case solved from the air before anyone landed. You had all the information, she said. You just needed someone to ask the right question. That's what good diagnostics is, he said. Asking the right question. He paused. Can I ask you one? Go ahead. Why are you answering phones at a civilian hospital? The question landed with a quiet precision that made her understand he hadn't asked it casually. He had been thinking it since she walked in. She looked at her hands for a moment. Her left knee was aching in a way that was getting harder to ignore. Because it's what I could get, she said. That's not an answer. No, she said, it's not. She looked up. I came back from Kandahar, and I couldn't fly anymore, and I couldn't be in the field anymore, and I needed to work because work is the only place I know how to be myself. So I took what was available, and what was available was a desk. Okafor nodded slowly. He didn't offer false sympathy. That was the right call. She would have liked him less for it. We're losing people like you, he said. People who know things that don't get taught in classrooms, who know them because they live them. He leaned forward. I'm not in a position to offer you anything formally, but I know people who are. People who run training programs for field medical personnel, who develop protocol curriculum for combat trauma care, who are looking for experienced advisors who can put exactly what you did today into a format that gets taught. He held her gaze. Would you be interested in a conversation? She was quiet for a moment. Not because she was uncertain. She had been certain of something for approximately the last 4 hours that she hadn't been certain of in 3 years. But she wanted to answer honestly, and honest answers to real questions deserved a real pause. Yes, she said, I would. Hatcher, sitting beside her, said nothing. But she felt the shift in him, something releasing, like he had been waiting for that answer for longer than today. Then the corpsman appeared in the doorway. He was holding a phone, and his expression, he had changed in the way expressions changed when something new had arrived in a situation that was supposed to be settling. Major Hatcher, there's a call from Mercy General, a Dr. Caldwell. The corpsman paused with a specific discomfort of someone delivering a message they did not write. He's requesting that Angel 6 be returned to the hospital immediately. He says she's in breach of her employment contract and he has legal counsel involved. The room went very quiet. Okafor looked at the corpsman, then at Sophia, then slowly at Hatcher. Hatcher stood up. He had the deliberate, unhurried movement of a man who was not angry, who was something much colder than angry. He took the phone from the corpsman. He looked at the screen. He looked at the number. Give me a moment, he said, and walked into the hallway. Sophia and Okafor could hear his voice, not the words he was speaking quietly and with control, but the tone, the specific tone of someone who held authority and was using it with complete comfort, someone who had signed documents that superseded other documents, someone who was making very clear, very calmly, that there was a hierarchy in this situation and that Dr. Bennett Caldwell was not at the top of it. It lasted 4 minutes. Hatcher came back. He set the phone on the table. He sat down. Dr. Caldwell, he said, has been informed that Angel 6 was operating under interagency authorization, that her actions today are a matter of formal military record, and that any legal action taken against a person who has rendered material assistance to a decorated officer of the United States Marine Corps would be, he paused, chose a word, inadvisable. Okafor made a sound that was not quite a laugh, but was close. Sophia looked at the phone on the table. She thought about Caldwell standing in that trauma bay this morning, pointing her toward the desk. She thought about the way he had said her name Sullivan, like it was a synonym for inconvenience. She thought about 11 months of being managed and minimized and carefully kept at a distance from anything that might reveal what she actually was. She wasn't angry. That surprised her. She was something more useful than angry. She was decided. Hatcher, she said, yeah. When I go back, and I have to go back, I have a shift tomorrow and patients who need someone at that desk, even if Caldwell doesn't think that someone needs to be me. You don't have to justify going back. I know, I'm not justifying. I'm telling you that when I go back, something is going to be different. She picked up the phone from the table and handed it back to the corpsman without looking at it. Tell Caldwell she'll be back when she's done. The corpsman looked at Hatcher. Hatcher nodded. The corpsman left. Okafor looked at her with an expression she was starting to recognize. The expression of someone who was recalibrating, who had come into a situation with one set of assumptions and was now operating with a completely different set and was doing the work of adjusting without resistance. That conversation I mentioned, he said, about the training programs. I remember it. I think we should have it before you get back on that helicopter. She nodded. I think so too. Outside, the storm that had been threatening all morning had arrived. She could hear it in the walls when, finding the edges of the building, the particular low sound of snow on a day when the snow meant business. The helicopters were grounded. They weren't going anywhere for a while, which meant she had time. For the first time in 3 years, time felt like something given to her, rather than something passing by her. She sat back in the chair. Okafor pulled out his own phone and found a number and started talking, and the conversation that began in that small waiting room on a military base in a December snowstorm was the conversation that would change everything. But first, Sophia Sullivan allowed herself exactly 10 seconds to feel what she actually felt. It wasn't victory. It was something quieter and more permanent than victory. It was recognition, the recognition of herself by herself as the person she had never stopped being, even when everyone around her had decided she was something less. She gave herself 10 seconds. Then she leaned forward and got to work. The conversation with Dr. Okafor lasted 2 hours and 14 minutes. Sophia knew the exact length because she tracked it the way she tracked everything, not obsessively, but with the quiet awareness of someone who understood that time in a medical context was never abstract. It was always attached to something, a window, a decision, a life. What Okafor laid out was not a job offer. He was careful to say that twice because he was an honest man, and honest men did not offer things they did not yet have the authority to give. What he laid out was a framework, a real one, built on real infrastructure that already existed, a network of training programs across 4 military branches that were actively looking for experienced field medical personnel who could translate lived combat trauma experience into teachable curriculum. He named figures, people she knew by reputation. One she had worked with directly in 2020, a woman named Commander Patricia Reyes, who had been developing a bilateral trauma response program for 2 years and had told Okafor just last month that her biggest gap was practical field knowledge from nurses, specifically not physicians, because nurses were the ones who made the real-time decisions when the physician wasn't in the room. Sophia sat with that for a moment. Nurses were the ones who made the real-time decisions when the physician wasn't in the room. She had been making those decisions for 4 years before Kandahar. She had 41 lives worth of those decisions behind her. "I want to talk to Reyes," she said. "I'll make the introduction today," Okafor said, "before you leave. And this is something I can do while still working clinically." Initially, yes, most of the curriculum advisory work is remote. Review consultation protocol development. The in-person components are intensive but scheduled. You would know months in advance. He looked at her steadily. "The question is whether your current position allows the flexibility." She thought about Mercy General, about Caldwell, about the desk. "That's being resolved," she said. Hatcher, who had been quiet through most of the 2 hours, made a sound that was not quite agreement, but was close to it. He was leaning against the wall with his arms crossed, and he had the look of a man who had opinions he was choosing not to volunteer, which for Jackson Hatcher was actually unusual. She looked at him. "Say what you're thinking." "I'm thinking," he said carefully, "that Mercy General does not deserve what you've been giving it, and that what you've been giving it is extraordinary restraint. I needed a job." "You needed a place to recover," he said. "There's a difference, and I think you know the recovery is done." The words landed somewhere specific. Not painfully, she had moved past the stage where honest things landed as pain. They landed as confirmation. The kind of statement that doesn't create a new truth but names one that was already there. "Yeah," she said quietly, "I know." The storm outside had not broken. If anything, it had deepened through the afternoon, which meant the flight back was still grounded and would remain grounded until the base meteorologist cleared it. The corpsman had checked twice. Both times the answer was the same: not yet, possibly evening, possibly early tomorrow morning. Sophia had noted this with equanimity. She had nowhere to be that was more important than where she was. She checked in on Marius at 3 in the afternoon. He was resting post-procedure, his pressure stable in a way that was now genuinely stable, rather than the false stability they had been seeing earlier. The small pneumothorax had been addressed. The leg was immobilized and would be until transfer for surgical repair. He was on a corrected medication protocol, and Okafor's notes were thorough enough that any receiving surgical team would have the full picture. When she walked into the room, he was awake. He had that particular wakefulness of someone who has been unconscious for a while and is now very deliberately taking in every detail of their surroundings, cataloging it, reassuring themselves of reality. "Sullivan," he said. "You should be sleeping," she said. "I'll sleep on the transfer flight." He watched her pull a chair to the bedside the same way she had done that morning. "How long are you grounded?" "Until weather clears. Could be tonight. Could be morning." He nodded. He was quiet for a moment in a way that was not uncomfortable. Marius had always been a man who was comfortable with silence, which in her experience was a mark of someone who thought before they spoke. "I owe you an explanation," he said. She looked at him. "For what?" For why I wrote your name on that form the way I did. Angel 6 only. He paused. I knew it would pull you back into something you'd stepped away from. I knew it would not be simple for you, and I did it anyway. You needed someone. I needed you specifically. He met her gaze. And I had heard through channels, which means through the kind of imprecise information that travels through military networks and is 70% accurate on a good day, that you were not doing well. That you had taken a desk position somewhere and were not practicing at your level and were not happy. She absorbed this. Who told you that? Reyes, she has contacts at the VA network. She'd been trying to find a way to reach out to you for months, but she didn't have direct contact, and she was worried about overstepping. Sophia stared at him. Patricia Reyes knew about me. She's known about you for 2 years, since a field report from Helmand crossed her desk, and she tracked down every person on the medical team to get their full histories. He almost smiled again. It still looked like it hurt, but there was warmth in it. You were not forgotten, Sullivan. I want you to understand that. The people who know this field, who really know it, they did not forget you. This was the thing she had not been prepared for today. She had been prepared for the medical work, for the complexity, for the pressure, for the process of pulling a diagnosis out of incomplete information in a time-constrained environment. She had spent 3 years staying ready for that, even when no one around her knew she was doing it. She had been ready. She had not been ready for this. For being told that the world she thought had closed behind her had actually been looking for a way to open back up. That the silence she had read as forgetting had been something else entirely. Her throat was tight. She did not look away from him because she was not the kind of person who looked away, but she took a breath that was slightly longer than necessary. I spent a year, she said, being told I was a liability. By people who didn't know what they had, Mayers said, with a quiet, absolute certainty. She nodded once. It was all she could manage for a second. Then her pager went off. It was not her hospital pager that was back at Mercy General. It was the temporary base communications device Okafor had given her when she arrived. She looked at the message. It was from Okafor. 4 words, come to my office, not urgent, but immediate. Those were different things, and she had learned to tell the difference. She excused herself from Morris and walked to Okafor's office, which was 3 doors down the same corridor. She knocked and entered and found Okafor behind his desk with his phone on speaker and an expression that she was beginning to read as his version of controlled excitement, a subtle animation in the eyes, a straightness to his posture that was slightly beyond his normal baseline. I have Commander Reyes on the line, he said. Sophia stopped in the doorway. She wanted to speak with you directly. Okafor continued, tonight, before you leave. From the phone, a voice, clear, direct, the voice of someone who was accustomed to being the most prepared person in any given room. Sullivan, Patricia Reyes, I'm not going to waste your time or mine with small talk. Are you interested in coming back? Sophia walked to the chair across from Okafor's desk and sat down. Define coming back. Advisory position. Protocol development for the bilateral trauma response curriculum I'm building. In-person intensive workshops 4 times a year, plus remote consultation. We're in the formal development phase, which means your input shapes what gets taught, not just how it's delivered. It pays accordingly. And host, Reyes paused, and the pause had weight to it, the kind that preceded something real. We're in conversation with 2 hospital networks about a joint clinical placement program for medically discharged personnel. People with your background who have been absorbed into positions that don't use their skills. You would be a candidate for that placement, which would mean a clinical role commensurate with your actual experience level, not a desk. Sophia was quiet for 3 seconds. You've been building this for a while, she said. 2 years, Reyes said. I've been building it with you in mind for most of those 2 years, if I'm being honest. Today just moved the timeline. Why today specifically? Because today, Reyes said, you solved a case from the air in 40 minutes that a field surgeon with 12 years of experience couldn't crack in 2 hours. And you did it while coming off an 11-month desk assignment that would have broken most people's confidence down to nothing. And you walked off a military helicopter in a December snowstorm on a leg that should have slowed you down and didn't, and you went straight to work. Another pause. That is not someone who has lost a step. That is someone who has been wasted. and I am done watching this field waste people like you. Okafor across the desk was looking at a spot on the wall to the right of Sophia's shoulder, giving her privacy within a room. It was a kind instinct, and she noted it. I'm going to need to untangle some things on my end, Sophia said. I know. Take the time you need, but I want a yes or no on whether you are interested before you leave that base. Yes, Sophia said. I'm interested. Good. Reyes's voice shifted, not warmer exactly because it had already been warm, but more direct. There's one more thing. The hospital network conversation I mentioned. One of the two networks is looking at a trauma program director role for their eastern region. It's a build-from-scratch position, someone who can take a department with solid staff and average outcomes and rebuild the protocol structure from the foundation. It would require someone who knows field trauma at the level you know it and who also knows how to work within a civilian institutional structure. A beat. You've spent a year in a civilian hospital. I'd argue that qualifies. Sophia looked at the wall, at nothing specifically, at the architecture of what she was hearing, the way it fit together, the way this day was assembling itself into something she genuinely had not seen coming at 6:43 this morning, when she was logging intake charts and answering to a man who thought her leg was the most important thing about her. That's a significant role, she said. You're a significant person, Reyes said. It was matter of fact, not flattery. Those two things should match. After the call, Sophia sat in Okafor's office for a few minutes. Okafor did not push. He made 2 cups of coffee from a machine on his shelf and set one in front of her and drank his own with the patience of someone who understood that some information needed processing time. She's serious, Sophia said. It was not a question. Reyes doesn't make calls she's not serious about, Okafor said. She's been trying to reach you through indirect channels for months. Today gave her the direct line. She's been looking for me for 2 years, Sophia said. Saying it out loud was different from hearing it. And for 2 years I've been sitting at a desk in New Jersey thinking I was invisible. You were visible to the people who were looking, Okafor said. The problem was the people around you weren't looking. She thought about Caldwell, about the way he had looked at her limp and calculated in approximately 4 seconds that the visible limitation was the whole of her. She thought about how easy it was to let someone else's calculation become your own reality when you were tired and healing and just trying to stay functional. How 11 months of being told you were less gradually filled a space in you that used to be held by certainty. She thought about how today had emptied that space back out again. Hatcher found her an hour later in the corridor outside Mara's room. She had gone back to check on the colonel, and he had been sleeping, genuinely sleeping, his face finally clear of the tension of a man managing secret pain. She had stood in the doorway for a moment and then stepped back and let him rest. She told Hatcher about the call with Reyes, all of it. He listened without interrupting, which was one of his best qualities, and when she finished, he stood quietly for a moment with his hands in his jacket pockets. That's what I hoped would happen, he said. You knew about Reyes. I knew she'd been trying to find a way to reach you. I didn't arrange today, but when today happened, he paused. I made sure Okafor knew who you were before we landed. She looked at him. How long have you known where I was working? 8 months, and he said, give or take. And you didn't reach out. Because you didn't want to be reached out to, he said, with the directness that she had always trusted in him, even when it stung. You went civilian and went quiet, and I respected that. People get it to choose their recovery. He met her eyes. But today was different. Today there was a man who needed you specifically, and I had the authorization to come get you, and I wasn't going to let that opportunity pass. Not for his sake only. She understood what he was saying. He had come for Mares, but he had also come for her. Not to rescue her, she rejected that framing, and he would have rejected it too. He had come to give her what the last 3 years had not given her a reason to stop holding herself back. You could have just called, she said. Dry. Quiet. He almost laughed. It was the closest thing to laughing she had ever seen from Hatcher. 4 Marine helicopters seemed more efficient. She shook her head, but she was not entirely not smiling. At 6:40 in the evening, the base meteorologist cleared a weather window. 40-minute gap in the storm system, enough for a clean flight back. The pilots were ready in 20 minutes. Sophia said goodbye to Okafor with a handshake that carried more weight than most handshakes and a commitment to speak with Reyes' team within the week. She went back into Mayor's room and found him awake again. I hear you're leaving, he said. Weather window. Good. He looked at her. Sullivan, what you did today, I know it cost you something to come back into this. I know it wasn't simple. Nothing worth doing is simple. No. He paused. But some things are worth doing anyway. She nodded once, the same way she had nodded before the nod that said, I hear you, I agree, and I'm not going to make a speech about it. Get some sleep, Colonel, she said. Actual sleep. When I get to the surgical facility, he said, on the flight. She turned to go. Angel 6, he said. She stopped. Don't let them put you behind a desk again. She stood in the doorway with her back to him for 1 second. Then she said without turning, not a chance. The helicopter lifted into the gap in the storm, and the base shrank below them, and the dark December sky surrounded them. And Sophia Sullivan sat in the back with Hatcher across from her and said nothing for a long time, and found that the silence for the first time in years was not the silence of someone holding themselves back. It was the silence of someone who knew exactly where they were going. The lights of the city appeared below them through breaks in the cloud. She recognized the grid of it, the way it spread outward from the center, the specific cluster of lights that meant the hospital district. Mercy General was down there. Caldwell was down there. The desk was down there. She was going back. But she was going back as someone who had made 3 decisions in the last 8 hours that would dismantle everything Caldwell thought he knew about her. And she was going back with Hatcher's number in her phone and Reyes's name in her contacts, in the voice of a colonel who had written Angel 6 only on a form, because he knew without question that she was worth the effort of finding. The helicopter descended, and Sophia Sullivan looked at the city coming up to meet her and felt something she had almost forgotten. The texture of the particular readiness of a person who is about to walk into a room and change it. The helicopter touched down at 7:52 in the evening. Hatcher walked her to the edge of the landing pad and no further because she had not asked him to walk her further, and he understood the difference between support and escort. He shook her hand once firm and brief, the way military people said the things they did not have language for. Call Reyes by Friday, he said. Wednesday, she said. He nodded. Something in his face settled the specific settling of a person who has been carrying a concern for a long time and has just been given permission to put it down. He stepped back. The rotors picked up. She turned and walked away from the helicopter and did not look back because looking back was a habit she was actively breaking. The parking lot of Mercy General was quieter than it had been that morning. The snow had come and gone and come again, thin and persistent, the kind that did not accumulate dramatically but covered everything in a layer of white that made the familiar look strange. Her car was where she had left it. The hospital windows were lit. Inside, the night shift was running. She stood at the entrance for exactly 3 seconds. Then she pushed through the doors. The lobby was different at night, slower. The day's urgency compressed into the particular low-grade alertness of night staff, who knew something could happen at any moment and had made their peace with the waiting. Priya was back at the main desk, second shift. Double shift. Sophia didn't know which, and when she looked up and saw Sophia walking through the doors, her eyes went wide in a way that was not subtle. You're back, Priya said. It came out halfway between statement and question. I'm back, Sophia confirmed. She kept moving toward the staff area. Is Caldwell still here? Priya hesitated. The hesitation was informative. He extended his shift, she said carefully. There's been a lot of discussion since this morning. What kind of discussion? Priya looked at the desk's surface for a moment, then back up. The kind that happens when 4 military helicopters land in the parking lot and take one of the nurses, and then someone from the base calls the hospital's legal department and speaks with the board chair directly. She paused. Dr. Caldwell has been in his office for about 2 hours. Administration was in there with him for 45 minutes of that. Sophia absorbed this without visible reaction. She had not known about the board chair call. Hatcher had not mentioned it, which meant it had happened outside of what he told her, which meant someone, possibly Reyes, possibly the base commander, possibly someone further up a chain of command she didn't have full visibility into, had made a call that went above Caldwell's level entirely. Thank you, Priya, she said and kept walking. She went to the locker room first. She needed 2 minutes. Not to compose herself, she was already composed. But there was a difference between composed and ready required a specific internal act that she had learned in the field. The act of deciding before you walk into a difficult room exactly who you are in that room, what you will say, what you will not be moved by, where your line is. She stood at her locker and ran through it in 60 seconds flat. She knew what she wanted. She knew what she was prepared to walk away from. She knew that she had Reyes's offer, Okafor's endorsement, Hatcher's backing, and the formal military record of today behind her. She knew that she did not need Caldwell's approval and had never needed it. And she knew this was the part that had crystallized somewhere over the city on the helicopter ride back, that she was not coming in here to fight him. She was coming in here to finish something. She closed the locker and walked to his office. She knocked twice, firm, not aggressive. His voice from inside, "Come in." She opened the door. Caldwell was behind his desk. He looked different from this morning. Not smaller exactly, he was still the same physical man, still silver-haired and upright and accustomed to being the most significant person in any given room. But something had happened to the certainty in his face. There was a quality to his expression she had not seen before, a careful, watchful quality like a man who has been given information that requires him to reconsider a position he has held for a long time and is in the process of doing that reconsideration and finding it uncomfortable. He looked at her standing in the doorway. He looked at the dried snow on her jacket and the 11 months of everything that had happened between them and the fact that she was here at all after the day she had just had. He said, "Sit down." She sat. He did not speak immediately. He looked at his desk, at his hands. He was a man who was good with words in situations where the words came easily, where he was right and the argument was clear. This was not that situation, and he knew it. "I received a call from the board chair at 3 this afternoon," he said. "I heard." "From who? Does it matter?" He looked at her. "The board chair told me that you had operated today under full interagency military authorization and that your actions were, He paused and his jaw shifted slightly, cited as materially contributing to the preservation of life of a senior military officer. Another pause. "She told me she was made aware of your service record and your credentials, your full credentials." Sophia said nothing. She let the silence do its work. "I was not aware," Caldwell said, "of the extent of your background." He delivered this carefully, like a man placing something fragile on a surface and hoping it doesn't break. "Your file at this hospital reflects your medical discharge and your current licensure. It does not reflect. It reflects what it needs to reflect to do this job," Sophia said, "which is the job you gave me." The precision of that landed. She saw it land. He sat with it for a moment. "The board," he said, "has asked me to review your role here." "I know." He looked at her sharply. "How do you know that?" "Because it's the logical consequence of today," she said. "And because I would have done the same thing if I were on the board and someone called me about one of my nurses." She held his gaze. "What did you tell them?" He was quiet for a beat too long. "I told them," he said. And his voice had a quality in it she had not heard before, not quite humility, but the neighbor of humility, the thing that lives right next to it, that a review was appropriate. That surprised her. She had expected deflection. She had expected the sophisticated practiced deflection of a man who had been deflecting accountability for long enough that it had become reflexive. What she had not expected was this bare, reluctant honesty. "Dr. Caldwell," she said, "I'm going to tell you something, and I need you to actually hear it. Not manage it. Hear it." He looked at her. "I am good at this," she said. "At medicine, at trauma response, at the specific hard nonlinear work of keeping people alive in conditions that are not controlled and not clean and not predictable. I am very good at it. I have been good at it for a long time. And I came to this hospital after the hardest year of my life, and I took the job that was offered because I needed to work and I was willing to accept less than I was worth in exchange for stability." She paused. "That was a decision I made for myself. But the way you treated me here, the way you used my injury to justify keeping me away from everything I was qualified to do, that was a decision you made for me. And it was wrong." The office was very quiet. Caldwell did not speak for a long moment. When he did, his voice was lower than his usual register. "You're right," he said. She had prepared for a lot of responses. That one she had not fully prepared for. I made an assessment, he said, based on what I could see, and what I could see was a limp and a desk assignment and a personnel file that didn't tell the full story. He stopped. He looked at his hands again. I did not ask the questions I should have asked. I made a determination and I held it. You made a determination about my value based on how I walked, she said. Flat, not cruel, factual. Yes, he said. The words sat between them. She let it sit. Then she said, I'm not going to be at this desk much longer. I have a meeting next week with a program that's going to change the direction of my career. I'm telling you because you deserve to know directly, not through administrative channels. She looked at him steadily. But before I go, I'm going to tell you something else. You have good nurses in this building. Darnell, Terry, Priya, people who are working at 70% of their capability because the system around them doesn't ask for the other 30. That's not entirely your fault, and it's not entirely fixable, but some of it is a culture problem, and the culture problem starts at the top. He looked at her. You're telling me how to run my department. I'm telling you what I see, she said. You can do with it what you want. He was quiet again, a different quiet this time, not the quiet of discomfort, but the quiet of someone actually thinking. She had not been certain he was capable of that kind of quiet. She was revising her assessment in real time. The board has proposed a restructured clinical role for you, he said, pending your agreement. It would involve trauma bay participation on a rotation basis and a formal mentorship component for junior staff. It came from them, not from me. He paused. But I didn't argue against it. She looked at him. Why not? Because it's the right call. He said it simply, like a man who had spent 2 hours sitting in his office, being wrong and had come out on the other side of it with something more valuable than pride. And because, he stopped. Tried again. I have been in this field for 30 years. I know what competence looks like. I saw it today when you walked out of that lobby, and I saw what came after, and I knew what I was looking at. His jaw was tight, but his eyes were direct. I should have known what I was looking at 11 months ago. The thing about a real apology, a genuine one, not the perform kind, was that it didn't announce itself. It arrived quietly, and it was specific, and it left space for the other person to decide what to do with it. This was a real one. Imperfect late, delivered by a man who was still visibly uncomfortable with the necessity of it, but real. She stood up. Dr. Caldwell, she said, I'll think about the board's proposal. I'll give you an answer by the end of the week. She moved toward the door. Her left leg ached from the cold and the day and everything the day had contained. She did not slow down. And I'm going to go check on 2 patients who were admitted during the code black this morning. Because I'm still on the clock and that's what I'm here to do. She was at the door when he said Sullivan. She stopped. For what it's worth, he said. What you did today, what I understand of it, was exceptional. She turned to halfway, not all the way, enough. I know, she said. Oh, and she walked out. The hallway was bright and familiar, and she moved through it differently than she had moved through it this morning. Not faster, not louder, but with a quality in her stride that was new and also very old, the quality of a person who occupies the full space they are entitled to occupy and no longer manages themselves down to fit a smaller frame. She checked on the 2 code black patients. Both were stable. The attending overnight had them well covered. She reviewed the notes, asked 2 precise questions, made 1 suggestion that the attending wrote down immediately and thanked her for. Then she went back to the desk. Priya was watching her with the careful attention of someone who had been in the same building for the same day and was trying to understand what had just shifted. Everything okay? Priya asked. Getting there, Sophia said. She sat down. She pulled up the patient log. She began doing what she had been doing for 11 months, the work that was in front of her, the work that was available, the work that mattered even when it was small. But tonight it felt different. Tonight the desk was a temporary place rather than a permanent one. Tonight the phone she was answering connected to a hospital that did not yet know what it was about to lose or what it was about to be given in the brief time remaining before she moved towards something larger. She thought about Reyes, about the curriculum, about a program director role built from scratch for someone who knew how to build things out of whatever was available, who had learned that skill, not in a classroom, but in the back of a moving helicopter with limited supplies and unlimited necessity. She thought about Morris, sleeping in a transfer facility with a stabilized pressure and a leg that would heal. She thought about Hatcher's almost laugh, the closest she had ever seen him come to one. She thought about Okafor handing her a cup of coffee and waiting with the patience of someone who understood that information needed time to settle. She thought about the sergeant at Camp Lejeune with a wife and 2 kids who was alive because 11 years ago, a nurse had refused to believe that the math was settled. She thought about 41 people who were walking around in the world today because she had been in the right place at the right time with the right skills and the right refusal to accept that the situation was unwinnable. 41 people, and a colonel who would be 42. And whatever came next, Reyes's program, the director role, the conversations she hadn't had yet, the decisions she hadn't made yet, whatever came next would carry forward from this specific day. This specific, unremarkable Tuesday in December that had started with the desk and ended with everything changed. At 9:47 in the evening, her phone buzzed. A text from an unknown number that resolved when she looked at the contact Hatcher had saved for her before she left the base into Commander Patricia Reyes. It said, "Heard you're coming back. Welcome home, Angel 6. Sophia Sullivan read it once, turned the phone face down on the desk, and for the first time in 3 years, she smiled in a way that had nothing to do with managing anyone's expectations of her. She picked the phone back up. She typed, "Wednesday. I'll call you Wednesday." She set it down. She pulled the next intake chart toward her and started reading because there was work in front of her and she did not waste time, and because Sophia Sullivan had never needed fanfare or ceremony or the acknowledgement of people who hadn't been paying attention. She needed a mission. She needed a purpose. She needed to know that what she carried, the knowledge and the grit and the 41 lives and the one leg that ached in the cold, that all of it was being used for something real. Today she had been reminded by 4 Marine helicopters in a colonel's handwriting and a surgeon who said thank you like he meant it that it was. She wasn't the limping nurse anymore. She had never been the limping nurse. She was Angel 6. She had always been Angel 6. And Angel 6 had work to do.